A lot of debate here going on because the FDA panel has reignited controversy surrounding antidepressant use during pregnancy, warning of risks like birth defects, etc. You're a psychiatrist, so I'm sure that you know this firsthand and what this means. What's the FDA saying right here, and what are you all as doctors hearing that may be right and not so much?
The concept behind this panel is to have informed consent, which we love in psychiatry. We want to make sure that anytime a patient is taking a medication, they know the risks and benefits of both things.
Right.
The thing that's being pushed back a little bit here is that the number one cause of concern for a new mom is actually mental health concerns. We want to weigh the risk of untreated mental illness with the risk of medication. That's the part that's causing a little bit of controversy.
So what are they saying as it relates to the baby, to the fetus? Because I agree with you. I think pregnancy, the hormonal shift is insane, and then especially postpartum. But obviously in utero, you're caring for a child, and that, I imagine, because you're sharing blood, the medication can go into the child. What's the concern there? Does it have to do with abnormalities, physically speaking? Are we talking about other mental issues for the baby's developing brain?
Yeah, absolutely. So what's being sort of highlighted in that panel, some things that many folks have agreed with for a while, which is that there are some risks that you want to be aware of, whether it's preterm birth or low birth weight, but there are some things that are actually not true and have been debunked for a while, things like risk of autism. That's not actually true, and that's why the president of even the American College of OBGYNs is saying this is kind of scare women into not getting care, because you got to weigh the risk of untreated mental illness has a very significant risk on a fetus, on a newborn baby. So we want to be, when we look at those two things over the course of several decades now, medications in pregnancy are safe and effective for severe depression, severe anxiety, and bipolar disorder in women.